Most countries have the same kind of governing laws and regulations about how many embryos are transferred in an IVF treatment. In general, and to avoid multiple pregnancy, 1 or 2 embryos are transferred. The younger the woman and the better quality the embryo, less embryos are transferred. So for example, if the woman is 32 years old and has excellent embryo qualities, only 1 would be advisable to be transferred. However, it is a combination as well of talking to your health provider, your fertility specialist, and your wishes. Only in very few cases are 3 embryos transferred, and these tend to be in cases of poor embryo quality and in advanced maternal age.